Cognitive Behavioral Therapy, a complete guide to retraining your brain to overcome anxiety and depression. Written by Franz Bement. Narrated by Mutt Rogers. Introduction. Cognitive behavioral therapy is a common form of psychotherapy or talk therapy. You work with a therapist or psychotherapist in a structured way, attending a series of sessions. Cognitive behavioral therapy helps you to become more aware of negative or inaccurate thinking. It helps one to see challenging situations more clearly. The benefit then is to help you respond to these challenges in a more effective way. Cognitive behavioral therapy can be an important tool in combating mental health challenges such as depression, anxiety, eating disorders, or post-traumatic stress disorder, PTSD. However, not everyone who benefits from cognitive behavioral therapy has a mental health disorder. It can as well be a helpful tool to assist anyone wanting to successfully manage stressful life situations. This form of therapy does not end at the facility or clinic. A very meaningful way of treating your illness successfully is practicing your exercises at home and in stressful conditions. This propels you to have a better approach to life and minimize the intensity of negative feelings. Why it's done. Cognitive behavioral therapy is used to treat a wide range of issues. It's often the preferred type of psychotherapy because it can quickly help individuals identify and cope with specific challenges. Generally, it requires fewer sessions than other types of therapy and is done in a structured way. CBT is a useful tool to address emotional challenges. For example, it may help you manage symptoms of mental illness, prevent relapse of mental illness symptoms, treat mental illness when medications aren't a good option, learn techniques for coping with stressful life situations, identify ways to manage your emotions, resolve relationship conflicts and learn better ways to communicate, cope with grief or loss, overcome emotional trauma related to abuse or violence, cope with medical illness, manage chronic physical symptoms. Mental health disorders that may improve with CBT include depression, anxiety disorders, phobias, PTSD, sleep disorders, eating disorders, obsessive-compulsive disorder, OCD, substance use disorders, bipolar disorders, schizophrenia, and sexual disorders. In some cases, CBT is the most effective when it's combined with other treatments such as antidepressants or other medications. Risks. In general, there's little risk in getting cognitive behavioral therapy. However, you may feel emotional while undergoing this form of treatment. This is because CBT can cause you to explore painful feelings, emotions, and experiences. You may cry, get upset, or feel angry during a challenging session. You may also feel physically drained. Some forms of CBT, such as exposure therapy, may require you to confront situations you'd rather avoid, such as getting on an airplane if you have a fear of flying. This can lead to temporary stress or anxiety. However, working with a skilled therapist will minimize any risks. The coping skills you learn can help you manage and conquer negative feelings and fears. Chapter 1. What is Cognitive Behavioral Therapy, CBT? Cognitive Behavioral Therapy, CBT, is a type of psychotherapy that treats issues and enhances happiness by reprogramming or modifying dysfunctional behaviors, thoughts, and emotions. Unlike traditional approaches, which look into childhood wounds to discover the root causes of conflict, CBT concentrates on the solutions, motivating patients to challenge deformed cognitions and reprogramming destructive patterns or behaviors. Cognitive behavioral therapy
Sample complete. Ready to continue?